Chair calls Terri Carriker.
Carriker, thank you.
Testifying on behalf of herself, testifying for both bills.
Thank you, Chairwoman.
Would you identify yourself and,
yes.
and
I'm
state your
Terri
position?
Carriker. I am testifying for both House Bill 3785 and House Bill 892. Oops, sorry, 837. Sorry. I live in Hays County. I'm in Austin address, but I'm in Hays County. I'm a conservative Christian, wife, mom, and lifelong voting, law-abiding Texas Republican. My 12-year-old daughter, Catherine, continues to have uncontrolled seizures after 9 years of aggressive treatment. In spite of exhausting all medical options, she still has as many as 20 seizures daily. As you're aware, there are many other patients sitting here watching and listening online who need more than what the CBD-only legislation can provide. I remember watching those videos of the Figis in Colorado, and I was overwhelmed with hope because there was something out there that was helping these children like my daughter. But I also remember the crushing realization that it was still beyond my reach because it wasn't legal here in Texas. As a mom, it's also crushing to think that I could potentially get for my daughter what I need for her while leaving others out with their noses pressed against the glass, as it were, because they have a different diagnosis or need a different combination of compounds. Catherine's on 4 medications right now, the lowest number she's been on in 9 years. And while I know a lot of other children with epilepsy, I don't know any other who is on the same combination of medications or at the same dosing levels. Like CBD-only legislation, House Bill 3785 offers access for children like my Catherine, but it also stretches out further to cover others who are just as desperately in need of safe treatment options beyond what is currently available. It allows doctors to determine what their patients need to treat their specific diagnoses and in what combination, just as they do currently with pharmaceuticals. In 5,000 years, there's never been a death recorded from the use of medical cannabis. But when my daughter was 5 years old, she developed the beginnings of liver failure from one of her anti-seizure drugs. We spent more than a week in the hospital with her having seizures every 15 minutes, literally around the clock. We didn't know if she was going to live or die. So we certainly do know what these pharmaceuticals do to the brains and bodies of patients, but we give them anyway. All medical treatment is risk versus benefit, and in this case, the benefit clearly outweighs any risk. I urge you to allow doctors and patients to assess those and give them access when it's deemed the best option. So I'm asking, please vote 3785 out of committee. For House Bill 837, our family is very active in the special needs community, and as you are well aware, we're far from alone in our difficulties. These shared struggles among parents develop an intimacy that we don't have with others, and I can tell you that there's a growing frustration with Texas' slow movement towards legalizing CBD tinctures and medical cannabis, even as the body of evidence in support of safety and benefits mount. We're watching just across the street, as it were, as parents and families are finding help and relief for those same suffering that our children are enduring. It's excruciating to have that be just out of our reach. In those same conversations, I'm hearing more and more often how parents, convinced by data, are finding ways to get these compounds even though it's illegal. These aren't drug culture parents, potheads, but determined to do the right thing, familiar with weighing benefit versus risk, and determining the benefit to be the greater of the two. Would not any of you steal bread for your child if he was starving? An affirmative defense bill would provide the smallest safety net for these parents who are put in an unconscionable position by our current laws. They would still have to account for their choices, but a judge could deem it a necessary one. So I'm also asking you to do the right thing and to vote House Bill 837 out of committee also. Thank you.
Thank you very much. Questions, members?